Alright, greetings new hire. It's me, Alan again from Kaiser Richmond and Josh Berg from Kaiser Oakland. In this module we're going to go over the Arctic Sun Therapeutic Hypothermia Cooling Machine for use on return of spontaneous circulation for VFib, VTAC, cardiac arrest, which is recommended by American Heart Association to give the patient the best chance for neurologically intact survival to discharge. All right, because that's how we're gauging codes right now, or the success of our codes. I'm not going to go over every single bit of detail in the ACLS algorithm because it is subject to change in a couple months anyway. Currently, right now, it stands at 33 degrees, which we're going to cool them down and acts as a neuroprotectant. But what I do want to go over is the features of the Arctic Sun cooling machine. First things first, gotta know how to turn this thing on. All right, pressing the button right here does not turn it on, even though it says on right over here. First thing you really actually have to do is flick the switch right in the back. There's a switch right where it plugs in, turn it on, and then press the on button. Keep in mind, it has to be plugged in. It is not battery powered. It has to be plugged in order for it to work. All right. So once you press the on button, here's a control panel. This will display the patient's temperature. So, with that in mind, you have to make sure the patient has a core temp Foley. So please make sure, after you're done, when you have return of spontaneous circulation and you're doing all your post-resuscitative care, in that post-resuscitative care, include a core temp Foley, not just regular Foley. Right? So it'll display the Foley, and it'll display other information like the water level and everything else. Now, you can see there's a lot of buttons right over here, if you can focus in on that. Here's a focus one right there, all right? But there's a lot of buttons on here. I don't want you to worry too much and get intimidated by the buttons. There's only one button you really have to worry about, automatic. That's the button, all right? Pretty simple, because that's the only button we're gonna use, all right? Let's go over the pads really quick. Let me zoom out for just a second. Here are the pads. They come in 4 different sizes: small, medium, large, extra large, grande, venti, I don't know. But anyway, so these pads, they're adhesive pads. They're very strong adhesive pads. And through these pads, when they're connected, this machine will go ahead and I guess infuse cold water through these pads. It'll self-regulate also, so you don't have to worry about dialing up the thermostat or thermometer on these pads. So they are adhesive pads. You can even see where they go on the patient. If you zoom in right over here, you can see that this one goes on the left flank. So take off the pads, and voila, goes right there on the left flank. All right. It also delints your clothes too. All right. And here's another one. You can take a look at this one. Take a look at where this one goes on the left leg. The placement of this is based on the baroreceptors of the body, so it will help rapidly cool down the patient. So once again, pads goes right over there. All right. So with these pads stuck on, and obviously one whole case has the other side as well. So take a look. There's a connector right on side here, and you can take a look at the connector over here. This is the connector to the Arctic Sun machine. All right. You can see there's a blue side and a white side. There's 2 connectors on this one, and it can take up to 6 of these pads. All right. There's a blue side and a white side. Make sure the blue side connects to the blue side over here, because there's also a blue and white side on here. All right. So you can see it doesn't work the other way. You have to make sure it's in. Now to plug it in, you just push it right in. Don't have to do anything special, but push it in until you hear the click. Click. Done. All right. Next, there is a. Oh, here we go. Hey, Josh. Here is your Foley. Hopefully this doesn't spill, but you have to have this connected to a core temp Foley. So there's a plug on here that connects directly to the core temp Foley, because this is how it's going to self-regulate the temperature, so you don't have to. That's why, hence, we have the automatic mode. All right. So let me show you what happens when you turn this thing on and you press one button. All right. Turn it on. Go ahead and press the automatic button. You can see temperature of the water. You see the target temperature, 33, and all I did was press the automatic button and it says flow priming. With these pads on me, you can even zoom in right over here. You're going to see in just a second, the cold water is going to start infusing through these pads. All right, and there we go. All right, it's getting there, but nonetheless, cold water will flow right through here. There you go, you can see it. And with the placement of these pads at the baroreceptors, it'll rapidly cool down the body, acting as a neuroprotectant for the brain. All right. Lastly, this patient's eventually going to go to the ICU. Here's the one big mistake that people make before they transport the patient to the ICU. They forget to press the purge button, and that's the other button you want to press. Because keep in mind, the ICU they have their own machine. They're gonna use their own machine, but these pads are on the patient. All right, they're on the patient. If you went ahead right now and unplugged the pads right here, you're gonna have quite a mess all over the floor, and you're gonna have to call EVS to clean it up. So please make sure when you're ready to transport the patient up to ICU, you press the purge button. All right, this button right over here. What it does is all the water that's in these pads, it sucks it right back into the machine. So just go ahead and press the purge button. Sucks up all the water. And the last piece I want to show you is how to disconnect it. I know it sounds super remedial and easy, but you gotta make sure you know how to disconnect it, because people have a hard time doing this. First, make sure that it's done purging the water. All right, you can see right now all the water is being purged. All right, getting there, we're getting there. And once it's done, all right, like I said, don't unplug it right now while it's purging. You're gonna have a nice little mess all over the floor. All right, workplace safety. That's in another video. All right, so checking water level, it'll say purge complete. And come on, purge complete, water level full. So all it did was take all the water that was inside these pads and put it back into the machine. Lastly, how to unplug it. You know, just people have a hard time doing this. You wanna squeeze right over here and actually push in first and then pull it right out. Might be a few drops, but nothing too major, as long as you purge correctly. All right, other than that, pads go up to the patient. Pads go up to ICU with the patient. Machine stays over here, unless your ICU does not have their own machine, or they need to borrow ours, then so be it. All right, so once again, just a quick recap, automatic and purge. Those are the only two buttons we're gonna use. Don't try fiddling with manual. You're going to get into a whole bunch of problems using that and all these other buttons, automatic and purge. All right, thank you guys.